What's up everyone? Back with another drawing tutorial, this time the aorta, specifically branches within the thorax and the abdomen. We first start off with the representation of our heart, and specifically the left ventricle. Blood that is expelled from the left ventricle ultimately will head up and through the aorta as it travels throughout the body. Just prior to the pelvis, the aorta will indeed bifurcate or split into two different arteries, left and right. Assume this drawing is from the anterior perspective, and then we can include some additional landmarks. The first landmark that we want to include is indeed the respiratory diaphragm. Diagrammatically speaking, that will be our diaphragm. And then we can begin to look at the segments of this aorta. Immediately after emerging from the left ventricle, from the superior aspect of the heart, obviously this blood is still ascending. So this would be referred to as the ascending aorta. Then we will have the arch of the aorta. And then on the other side of things, we would indeed have the descending aorta. Now, the descending aorta, we can be more specific. We can refer to the descending aorta when it's above the diaphragm as the thoracic aorta. And when it's inferior to the diaphragm, after passing posterior to it, we can refer to it then as the abdominal aorta. It remains the abdominal aorta until it bifurcates into two common iliac arteries. A right and a left common iliac artery. Again, diagrammatically speaking. So now we can take a look at the branches, the primary branches, off of each segment. First and foremost, we have to feed the heart tissue itself. So off of the ascending aorta, we will have a right coronary artery and a left coronary artery. Okay, a left coronary artery, again, diagrammatically speaking, LCA and RCA. Now, in reality, these arteries have an orifice or an opening at the aortic semilunar valve, also known as just simply the aortic valve. So in two of the three cusps of that aortic valve, there's an opening where we then receive blood within the left coronary artery and the right coronary artery. Off of the arch of the aorta, we will have three branches. Notice how the second and third branch, I go ahead and add the arrowhead. These are going to specifically be the left subclavian artery and the left common carotid artery. Whereas with the first branch off of the arch, it must branch again. Okay. So what we see here now is finally the right subclavian artery and the right common carotid. So what is that trunk referred to as that's giving rise to the right subclavian and the right common carotid? Well, the subclavian is going to the arm, so the brachium. The common carotid is going to the head, so cephalic. So this trunk there is referred to as the brachiocephalic trunk. Notice there's only one of those, also sometimes simply known as the brachiocephalic artery. There's only one of those. The left-sided structures, the left common carotid and the left subclavian, emerge from the aortic arch independently of one another. They do not share a trunk. Okay. Next up, the thoracic component of the aorta. Now we can draw in some bronchial arteries to the lungs, some esophageal arteries to the esophagus. For an introduction, we'll go ahead and just make sure that everyone keeps in mind that there are indeed arteries that would come off of this thoracic aorta and travel between the ribs. Now, we're not being exact with the number here, 11 or 12, but these are referred to as the posterior intercostals. posterior intercostal. Okay. And those will travel between one rib and the next on both the left and the right side. Again, we could add esophageal and bronchioles, but for the sake of introduction, the overall layout, this is sufficient. Okay. Now, if I take a look at the abdominal aorta, we can fill in the remainder of the branches. So now we have the need to have some landmarks that are abdominal contents, specific organs. Okay? And ultimately, what we can say is it's important to at least represent the liver on the right-hand side of the abdomen, just underneath that diaphragm. We also need to represent the spleen on the left-hand side. It's tough to represent the stomach because it's very much centrally located. It would cover up some of the lines. However, we can represent the kidneys. Okay. So let's go ahead and label the liver, the spleen, and the two kidneys. So now we're prepared to realize that to the digestive tract, to the gastrointestinal tract below the diaphragm, we have three unpaired arteries that will provide blood to the first, second, and third parts of it: the foregut, the midgut, and the hindgut. Unpaired meaning there's not going to be a left version of each artery and a right version of each artery. There's simply going to be one celiac trunk, one supramesenteric artery, and one inferior mesenteric artery. So again, celiac trunk or artery. Okay. You have the superior mesenteric artery and also the inferior mesenteric artery. Of course, common acronym CSI. Off of that celiac trunk, much like the word celiac has 3 syllables, you'll have 3 branches. It just happens to work out that way. One branch to the left has a very tortuous path, full of twists and turns over towards the spleen, likely because that stomach in front of that artery expands and contracts so much throughout life. Of course, we're going to call this branch of celiac the splenic artery to the spleen. Then there's a branch to the right, and prior to reaching the liver, it does indeed branch. That's going to be referred to as the common hepatic artery. The first name common does indicate a specific and significant branch. It's important to at least mention those. We have gastroduodenal and hepatic artery proper. Hepatic artery proper going to the liver specifically. Gastroduodenal does highlight the remainder of the blood supply to the celiac. It will provide blood, not only some additional blood to the stomach, but also to the duodenum. And the duodenum is the landmark where the foregut would transition to the midgut. So the artery will change as well from celiac to supramesenteric in terms of the origin, in terms of the source of blood. Okay. The third branch, we draw it kind of veering off to the left-hand side, is the left gastric. And again, that would go to the stomach. That's a bit challenging to illustrate when you're doing a line diagram like this. Okay. Now, would there be a right gastric? Yes. It emerges variably, commonly from the common hepatic, but sometimes also from the hepatic artery proper or even the gastroduodenal. So that one's a bit variable in its origin. Next up, we have the superior mesenteric artery. And we'll have an inferior mesenteric artery. It's important to realize what those are headed to. The superior mesenteric artery is going to the midgut. It's going to what we'll generally refer to as the midgut. And then parentheses, we can tell you what that means. The supramesenteric artery picks up where the celiac trunk, specifically the gastroduodenal, but the celiac trunk left off. So it's going to pick up the duodenum. It's going to provide blood to the jejunum, the ileum, that's small intestine. The cecum, which is the first part of the large intestine, ascending colon, and up until 2/3 of the transverse colon. At which point the blood supply transitions from superior to inferior. Inframesenteric then takes care of the hindgut. So that'll be the distal 1/3 of the transverse colon, descending colon, sigmoid colon, and is said to end where the blood supply ends, at the superior rectum. The middle of the rectum and the inferior rectum are actually going to be provided blood or receive blood from the internal iliac, a specific branch of the common. All right, so we can finish off the abdominal aorta with some bilateral branches that will have a pair, right? Some left and right equivalent in some way, shape, or form. So I won't draw both sides, but we do have some inferior phrenic arteries going to the diaphragm. We obviously need some arteries to the kidneys. So these would be referred to as renal. Now you can have one of these, you can have two of these, you can have three of these on each side. They're simply just called renal. And then we also receive blood to the gonads from the abdominal aorta. So we'll have a little representation there and there bilaterally for the gonadal artery. Both sides. Now that can be ovarian artery, that can be testicular artery, but ultimately the gonad, the ovary or the testicle, established its blood supply early on in its development. It also established its nerve supply, not a topic of today. But early on in their development, they were in the abdomen medial to the kidneys. So they established their blood supply and then ultimately dragged that artery down into their final position, ovaries and the pelvis, testicles and the scrotum. The left ovarian or the left testicular artery would ultimately originate from the abdominal aorta and then provide blood all the way down to the ovary or testicle. That connection is maintained throughout life. We can then finish this off with the branching of the common iliacs. So each one will split yet again. And common iliac will give you on both sides the external iliac, the external iliac, and the internal iliac. The external iliac and the internal iliac. External iliac ultimately will proceed inferiorly into the thigh, change names to femoral, within that femoral triangle. It does indeed pass deep to the inguinal ligament for that name change. The internal iliac, which deserves its own drawing if we're going to discuss each of the branches, will branch significantly within the true pelvis. Again, I mentioned a few of its branches to the middle rectal area or the inferior region of the rectum. It'll also provide blood to vaginal canal, prostate, urinary bladder, as well as a couple of arteries to the gluteal region and the genitalia. So it'll branch significantly within that pelvis. So again, the goal of this tutorial was to show you the overall roadmap of the thoracic aorta and its branches and the abdominal aorta and its branches. Hopefully this was helpful. And there are certain areas in this that deserve a bit more detailed of an image, detailed of a drawing. Things like the branching pattern of celiac, supramesenteric, inframesenteric, that will be in a different tutorial, a follow-up tutorial, as well as the branching of the subclavians, as well as, or branches from the subclavians, and also the branches of the common carotids, and potentially also the coronary arteries. So those, again, will have subsequent branching in a different tutorial. The goal of this was to provide a good overview, a solid foundation to the branching pattern of the thoracic aorta and the abdominal aorta. Enjoy the day.